today, we have with us three amazing child life specialists from Children's of Alabama, and we're going to learn more about the field of child life. So certified child life specialists often work in hospitals to support pediatric, excuse me, to support pediatric patients and their families during some of life's most difficult moments. So today we have Lindsey Smith, Kassidy Narber, and Kaitlyn Scheid, and they're going to tell us about their work within this evidence-based field that uses play-based techniques to positively impact patient outcomes. And so I'd just like to welcome our guests, Lindsey, Kassidy, and Kaitlyn. And at this point, I will turn it over to them.
Hey, everybody. I'm Lindsey, and I have been a child life specialist for 9.5 years here at Children's. Started out in the ER, and now I am up on the hematology, oncology, bone marrow transplant floor. So I work with a very chronic population, but I just wanted to introduce myself before we get started.
Okay, I'm Kaitlyn. I'm one of the child life specialists in the emergency department, and I've been a certified child life specialist for almost 5 years, and I've been here at Children's for a little over 4. And so I have been mainly in the emergency department, but in my other job when I worked in Knoxville, Tennessee, I worked in a variety of different departments, kind of helping out other team members as well. And so I've been on the team for, I guess, 5 years now.
And I'm Kassidy. I've been at Children's for about 5.5 years. I started here in the emergency department, and then I spent some time in the special care unit, and I've been working in the cardiology department for about 4 years now.
So we're going to get started and hopefully share a little bit more about child life. I know a lot of people are unfamiliar with that role within the hospital setting. So we are honored to get to be here today and get to talk a little bit more about that. So child life, we overall help get to meet the emotional needs of our patients and families while they're here. And so based off of a child's age and development, we can help them understand whether that be a diagnosis, a procedure, overall just the hospital setting. We get to really kind of help them cope through that hospital process while also coming alongside the family and providing emotional support for the family as a whole. And so we work a lot with siblings, we work with the parents, and getting the honor, honestly, to just be that therapeutic relationship for the families. And be a liaison really between the medical team and the family, and kind of getting to help be that voice and advocate for them on their behalf while they are here. So that's a little bit about child life and kind of what we do. We work alongside kind of all members of the medical team, the psychosocial team. It's a team effort for sure.
And we definitely have, of course, gone through training, and so our background is a bachelor's degree in human development and family studies with a concentration in either child life, psychology, child and family development education. And with those 4 years, there are certain requirements that we have to complete, as in completing around 10 hours of specific child life core classes. And then before we're eligible to take our certification exam, we have to complete a variety of volunteer hours with sick and well children, along with a practicum in the hospital environment under a certified child life specialist. And then after completing those, applying and completing a 600-hour internship in a pediatric hospital with a certified child life specialist. Once all those are complete, we're able to sit for our certification exam, where we are certified child life specialist. And so this certification is required for us to work in the hospital setting and work in the hospital environment, along with the other multidisciplinary team members as well.
Perfect. Okay, so we're gonna talk a little bit just about our role in the hospital as child life specialists. We wear many, many hats in the hospital, and a typical day is different for all of us based on if we're in the inpatient world or outpatient world working with chronic patients. But a big piece of what we do is providing education and resources to patients and their families. So that might be providing education about a new diagnosis or a procedure that's happening, and providing the resources that are developmentally appropriate for both the patient, their parents, and siblings as well. We work a lot with siblings to help them also understand what is going on with the patient. And so that can look a little different, whether you're providing education about maybe a new oncology diagnosis, or you're providing education about a procedure that the patient's never had. And we encourage understanding and cooperation with medical care by using medical play. That's a lot of the way we can see where misconceptions might be happening while working with kids, on letting them really get hands-on with medical equipment that they might not be familiar with, or maybe they are familiar with it, but they're not exactly sure what each piece does. And that is a really great time for us to kind of work through misconceptions they may have, clarify those misconceptions, and really help them gain mastery over their healthcare experience. Along with that, we do a lot of medical play and prepping patients for procedures they may be having. So I know in the emergency room, there are IVs happening all the time, and kids getting poked, they're having maybe sutures placed. And that's a great opportunity for us to provide preparation for those procedures, but also allow the kids to get hands-on with the medical supplies, so they can become more familiar with the procedure and it can help them cope more effectively. And along with that, we are available to provide support and distraction during those procedures to help them cope better. So whether that's we're taking deep breaths, or working on some guided imagery, or utilizing distraction tools to help them cope, that is a big piece of what we do. Along with that, children, their work is play. So we want to encourage that as much as possible while they're in the hospital. And that's also a great way to see if there's misconceptions that are happening about their hospitalization, or maybe their diagnosis, or maybe there's a common theme that keeps occurring in their play that we're seeing that we're able to address with them to help them better cope while they're here.
A couple of other things that our role includes is, we've already mentioned this, but working with siblings. A lot of times we see them kind of be left behind throughout this hospitalization process. And so we really try to, whether that's either giving the tools to the parents to provide that at home, we're able to do that, or we can also bring those siblings in here and do some of the education stuff that we would do just with the patient. We would do it with the sibling, and making sure that they're a part of this journey as well, because it does greatly impact them just as much as it does the patients and the parents as well. So I know for me in my role, being in the oncology world, they need to understand the patient's diagnosis, whether that be leukemia, whether that be a brain tumor, or what a bone marrow transplant is. They need to understand that just as much as the patient does. And, again, because of our background being in age and development and understanding kind of the process of the lifespan, we can clear up those misconceptions of, some kids think that they could catch this diagnosis, or if it's a sickness, they think that, or maybe they feel like it may be their fault because the patient is here, and that it's more of a punishment type thing depending on their age and development. So we can really kind of work with the siblings to make sure that they are, understanding themselves and kind of including them in on this journey. Providing emotional support to the families. I always view this as kind of the umbrella of our role. So again, I said this earlier, but we get to be kind of that therapeutic relationship for the patients and families. And it's not that other roles in the hospital can't be that, but we have sometimes the time to get to go in and provide that support, and we're there every day with them. Most of us work, 5 days a week, and so we're here throughout the whole week with these families day in and day out. And so, yeah, it's just neat to get to provide that emotional support. And honestly, what an honor that on some of the worst days of their lives, we get to be just a little glimpse of hope and support to them on those very, very hard days. So we are very thankful for that part of our role. And that kind of spills into every other part of our job. So if we have a rapport with our patients and families, we then are able to do the other end of education and prep because they trust us, and it's a trusting relationship. Whereas if we didn't have that emotional support, providing that, it would greatly impact really the other end of our role and kind of all the other things that we are able to do with them. And then the other thing we do is advocate for family-centered care. Because we are working with the family as a whole, and this is a huge thing for Children's of Alabama, is just providing that family-centered care, and really coming alongside them and letting them, have their voice and making sure that we are listening to them and what they want. Every family is different as they go through these very difficult days, and so really coming alongside them and making sure that we are individualizing our game plan and our care as best as we can. And again, getting to kind of be that liaison and speak with our medical team if it is something that we need to talk to them about that maybe the family is wanting. That's just a simple way that we can provide family-centered care. And then the last part is another role that we provide is support during end of life. And bereavement, and we do some legacy work, and we have different ways that we kind of provide that. But we have a good bit of resources to help children understand grief and help them understand, maybe what the death process looks like. And it can be sometimes speaking with the patients themselves if they are at end of life. A lot of times I want to encourage the parents to have those conversations so we can give them the tools and empower them with the tools to be able to have those conversations. But as I truly can't imagine as a parent, sometimes they need us to kind of fill that gap for them. And so if it's coming alongside and being with the doctor and being with the parent and the kid in the room and having those really tough conversations and helping guide that, we're able to provide that and help alongside kind of that end of life care and bereavement process. So yeah.
And just going off of what both Lindsey and Kassidy have said, we really do work very closely with the team. And so one of the ways that when we were working with the team about how to work with us or how to utilize us appropriately in the hospital setting. So really, if these patients have those new diagnoses or those illnesses and they need help understanding the diagnosis, kind of those first few steps or those first 24 hours of being in the hospital, we come together as a team, and us specifically for child life, that psychosocial support and figuring out a coping plan and help them with diagnosis teaching in the hospital. And then just like Kassidy had touched on, so one of the many things that we're able to do is implement medical play to our patients and even siblings as well, or maybe having a hard time understanding maybe their new diagnosis, not understanding what their port is or having their port access would entail. Specifically, like Kassidy has mentioned, in the emergency department, we do a lot of quick invasive procedures like IVs and sutures. And I know upstairs they do a lot of NG tubes and PICC placements that, are just something that a child has maybe experienced before or is not coping well with. And so we take that time out of their treatment plan to sit down with them and provide those hands-on tools for them able to manipulate it and master them and just gain that sense of control back. And if they would benefit from distraction during procedure. So we communicate with the medical team prior to a procedure and after we had prepped them for a procedure about a coping plan, about maybe any kind of support or distraction, whether that's any like physical distraction, like I Spy books or I Spy sheets, or maybe guided imagery, or practicing really great deep breaths, or practicing these coping skills that maybe they haven't learned before, but they're able to learn and then utilize throughout the rest of their, not just treatment, throughout their time in the hospital and throughout life. And so we really work well with the team to be there in those procedures and making sure that the child is coping appropriately during and appropriately after.
Another big piece of what we do in communicating with the team is getting information on if a patient is showing signs of fear, anxiety regarding really anything with their admission. And we can go in and assess whether maybe they need some therapeutic activities to help them have a release of emotions, whether that's, a teenager having the opportunity to journal, or an opportunity to meet other patients their age on the units and kind of just have that positive social outlet. Or for our younger kids, maybe it's having a little more intense play and letting them get some of that aggression out that they can't really get out in their room, but they can come on down to the playroom and we can throw balls and we can crash our cars together, and just kind of having that outlet for their emotions is a really big piece of what we do. And sometimes that's just being a listening ear while we're playing a game of Uno or doing an art project together while they're getting to do that creative side of things as well. It's also just a really great time for them to kind of just talk about what's going on and how they're feeling while they're at the hospital. And then from there, if there are certain fears or concerns they express, then we can develop a coping plan from there to help them cope better while they're at the hospital. Another piece of that is being in the hospital is really difficult, and one of like the number one reactions kids have is they don't want to be compliant with taking their medication or doing PTOT, or there's various things that happen in the hospital that aren't really fun. And so we can help with compliance for those things. So whether it's teaching them how to swallow pills, because now they're going to go home with 6 pills a day they have to take, and creating an incentive program for that to help incentivize these behaviors that we want to encourage, or whether it's creating a daily schedule so they have some predictability in their day. We will get kids that are here for just a night to kids that are here for 11 months at a time. And so to help normalize that and improve compliance and help with coping at the hospital, we can create daily schedules to give them just a little more normalization and routine, and also predictability in their day. There's a lot of unknowns that happen in the hospital, and when they can look at their schedule and see they have school at a certain time or child life's coming at a certain time, those are things that they can plan for, just to give them better predictability while they're here as well.
Yes, so definitely people can reach out to us for all of these things, but also I think that, even night shift, like sometimes they'll reach out if they see that a patient has had a change in behavior, kind of like Kassidy was saying, or if they see that they're having more of a difficult time. So we really try to kind of touch on all these things, like when to call Child Life, and make sure that all of our kind of team members are aware of that. And we try to be proactive in assessing that every day as well. But definitely, yeah, so if a child is having difficult time understanding or coping with a new diagnosis or a procedure, maybe making sure that the nurses are reaching out for that. If they could benefit from a daily schedule, kind of like Kassidy was saying, we have incentive charts. We've gotten very creative, I feel like, with our kids of like what would work for them. Again, individualizing that care and seeing like, okay, what's something that could really be motivating to them, and kind of working with that, things that they like and enjoy. And we learn those things through building rapport with them at first, and using that to then be able to, kind of have those incentive charts if they're struggling with meds and different things like that. And then medication noncompliance, I think we touched on with that. We have different ways that we can teach kids to swallow pills. That's something that I think about all the time. I'm like, when is the first time that I actually learned to swallow pills? Like, you don't think about that, or teaching your kids to know how to do that. And then when they're in this setting, they're all of a sudden, they've had a huge loss of control, and they're having to be made to do all these different things. And sometimes swallowing pills can be a huge stressor for our patients and families. And so, working with our families, getting them to kind of master that, can help kind of eliminate any stress that comes along with that. Sometimes it's the taste of the medicine that's the issue and why they won't do it, and sometimes it's actually, swallowing it. So we can kind of work alongside the family and figuring out a game plan that best kind of meets their needs with that. And then we've already talked about just bereavement needs that may come into play. Sometimes our families, I know, especially in my population, there's no way to kind of do it the right way as far as grief and bereavement. Like, it is very individualized to each family. And all we can do is play a part in advocating for what we think is best and what we've seen to be best for our kids, and what they may need to know based off of their age of development, or even just giving them the space to ask questions. There have been many times that, I think the child and the parent are both trying to protect each other. So they both just aren't saying anything. And if we can bridge that gap just a little bit to get them to open up and allow that space for them both to just talk, it's amazing what these kids actually know. And I know that as a parent, I'm sure they are very fearful to even bring up or broach the topic of death, and no parent should have to be having that conversation. But I've been in unfortunately, many conversations with kids and the parents, and we just start off with, what do you know? Start from the beginning. When you first were diagnosed, what did we do to get rid of that leukemia at the beginning? And then we get them to that spot, and they verbalize back to us that understanding. And then we start from there. And eventually it gets to where they really are verbalizing it themselves. And in a way that gives them control to have a voice and to say it. And there have been many times that, it's almost like the elephant is lifted outside of the room, because the parents, the kids are weeping, of course, but it's what they've been wanting to talk about all along. And obviously, again, I know we keep saying this, but based off of the age and development, depends on how we would have that conversation and maybe what would be said. And it is incredibly empowering to see those kids then get to make choices. If we do have the chance of, they have a month left, what is it you want to do? Do you want to take this medicine? If not, let's not do it. Do you want to go do these certain things? And that's the best kind of situation we could have in the midst of grief. There are obviously times that it is very unexpected and quick, and we can still come alongside the families and help them in those very, very broken and awful moments. But so we help a lot with the family as a whole, working through the bereavement process.
And we're very thankful that Children's respects our roles, so much so that we have Child Life on almost every floor, if not every inpatient floor here at the hospital. And so that, starts out in the emergency department, and we have Child Life and 1-day surgery on this campus, and at Children's South as well. And of course, hematology, oncology, and our bone marrow transplant. We have our burn, we have pulmonology, we have our PICU, which is our pediatric ICU, and then we have our special care unit and our EMU rehab. We have endocrine, and we have our inpatient 3 inpatient floors that we call them our dearth towers, and our renal dialysis floors, radiology, and our NICU. And then we also have our sensory pathway program here at the hospital. So what that are implemented throughout the entire hospital is any patients that come in with any sensory sensitivities, any sensory seeking behavior, our staff, not just Child Life, are trained to, help kind of assess those needs and provide those tools and resources for those patients and those families. And it's stressful enough coming to the hospital when you're not expecting it, so let alone, having a child with sensory needs, how to make that transition and make their time here as easy as possible. So we have our sensory pathway that we're rolling out, if not, it's already rolled out on different floors to help those staff members who are trained to give those tools and resources to the families. And so I feel like we are both in inpatient and outpatient setting. And so our child life, like all the things that we had talked about, are on the same in inpatient and outpatient. I think just based off different procedures, just different pace of the whatever that environment is, and any, I guess, diagnosis that we would see and end of life care. It varies just based off inpatient and outpatient setting. And so our child life specialists all work together as a team to help those needs, both inpatient and outpatient, in those fast-paced environments, reaching out for help, or helping with an end of life situation, that's on a floor, in a patient floor where that maybe end of life is heavy. We try to support each other the best that we can, and helping with those end of life or those memory making opportunities, whether that's like I said, inpatient or outpatient. I feel like we do a great job at working together with different flows and environments.
And I think it's been neat to see just over the years how much child life has grown. When I started almost 10 years ago, there was only like 10 of us, and now we are up to 26.
Yeah.
I think we're up to like 26, if not more. And that just shows me, just the fact that like people in the hospital see a need for child life, and we are so thankful for that. And so there's been a huge shift in kind of like seeing the need for child life and more of us. And I feel like we are definitely constantly growing, which we're very thankful for, to have a larger team, even from when I started out.
We figured we would touch a little bit on some artsy things, and kind of just talk about some of our work with the arts and medicine staff members that we get to work with at Children's. So coming from the world I'm in cardiology, we love having art and music therapy. Most of our units at least have art or music at least once a week, and they are some of the favorite people here in the hospital. Our kids love working with the art and music therapists, and they're really great to collaborate with while kids are at the hospital. So I'm thinking of all my cardiac patients. We have tons and tons of babies, and one of my favorite things to do is send Sunny, the music therapist, in to go be a soothing presence for those babies, but also for those parents. They sometimes are aware that their baby is going to have a heart defect, and sometimes not until after birth is their child diagnosed, and they get thrown into the intensive care unit. And sometimes they're first-time parents, their babies have huge surgical wounds and test tubes coming out of them, or they're intubated, and they don't quite know how to interact with their baby in that setting. And I love sending Sunny in, because she's calming for the patients, but also she is so good for our parents as well, and helping them know how to sing to their baby while they're at the hospital, or different ways to interact with their baby that maybe they wouldn't be doing when they're not in the hospital. Like, they can't have those typical experiences that people usually do when they bring their baby home from the hospital. But I love to send Sunny in to go help with those patients. And I'm thinking of like all of the kids that love to have Sunny come in, or any of the music therapists to come, kind of give them that emotional and like creative outlet. They write songs together. Sunny writes songs for them. Some of my long-term kids have learned how to play the guitar with her, or learn how to play piano. And it's just really cool to see the relationships those therapists are able to build with our kids as well. And same for art. We are so fortunate in cardiology and so many of the units to be able to have art therapists. And when I can't crack a kid, or if I'm having a hard time kind of figuring out what's going on with the kid, they're not opening up as well, I love to send art therapy in. They just have such a unique approach in how they work with the kids, and they're able, for these long-term patients that we have, create like ongoing projects every week with them, and it's something for them to look forward to. I had a kid that was here for months and months one time, and Valerie had been working, our art therapist had been working on a lot of pieces with him, and he ended up setting up an art exhibit at the end of his admission. He had the biggest smile on his face. He was so proud of it, and he was able to do all that with the work with Valerie. And they're also really great, and we keep talking about bereavements, but they're really helpful in those situations too. Sometimes they're able to do heartbeat recordings and set it to a song that the patient really enjoys, or creating kind of legacy items with art, with handprints, and turning them into these beautiful pictures that the patients and families work on together. So we're really fortunate to be able to work alongside the art and music therapists as well.
We also have a drumming therapist, and he is amazing, and again kind of has that outlet for our kids to express themselves, and it's really neat to see these kids like maybe that haven't ever even tried drumming, and they'll give it a shot, and then it becomes just their thing during the hospital time. And so we're definitely very thankful for each of our expressive therapists that work alongside us every single day.
Another cool program we have, and I can zoom the camera in, is we just recently started our medical dog program. And we have Wanda in here. She's taking a nap on the floor, so I won't make her move, but I will move the camera down so everyone can see her real quick, if it works.
She's real cute.
There she is, taking a little snooze on the ground. So that's Wanda. And she just joined the Child Life team in June. And so one of our Child Life specialists here started the medical dog program. We have Hand and Paw that we work with as well. But the thing that's really unique about Wanda is that while Hand and Paw works alongside volunteers that come into the hospital, and they're great and we love them, and they are so beneficial for our patients, Wanda is really cool because she is with a Child Life specialist all day. So she's either with me or her primary handler. And she comes with and is kind of just an extension of Child Life services. So if there's a patient that's really anxious about having an IV placed, Wanda can come and do the medical prep with them that we would normally do. We can tie tourniquets on Wanda and practice cleaning her fur like we would cleaning a hand before an IV placement. And it's kind of just like a very normalizing thing. To have a dog in the hospital, but then also she provides like a lot of emotional support too. So she can be present during the IV placement and provide positive pressure and support while the child's laying in the bed and having that done. She can come with us if we're trying to encourage mobility for a patient and they're really hesitant to get out of bed because they're sore or they're worried that they'll have pain. Wanda can come with and we can help get them out on the unit, and we can take Wanda for a walk. Or there's so many different things that we can do with Wanda. It's a really cool program, and we're just starting it off. She just got here in June, so it's a really fresh program, and she is consult based, so she sees children all over the hospital. She's got a very big job. That's why she likes to take naps while she can. But it's been really awesome to work alongside Wanda as her secondary handler and just see the positive impact that she's had on patients, families, and even staff members. Everyone is always excited to see Wanda, and she really just brings such a positive influence on the entire hospital. That's just a tidbit on her.
And then the last little kind of part that we were going to talk about is the other hat we wear kind of as child life specialists is we get to kind of put on the events in the hospital. And that is a really neat opportunity. Honestly, it's extremely therapeutic for even myself, getting to see the kids in that setting, and providing just like some fun and a place and times where they can just come down to, we have different rooms. This is one of them that we can set up different events, and they can engage in different activities and stuff that they would as a typical child outside of the hospital setting. So a couple big events that we put on throughout the year is one of them is Sugar Plum Shop, and that is where we are so grateful to have the community support that supports us and provides toys like you wouldn't believe, to basically set up an entire shop for Christmas, where our parents can come and shop for their kids as well as the siblings. If they're here during Christmas time, and we're able to provide Christmas for our kids. And that is just such a sweet event to get to help run and do alongside foundations and a bunch of people here at Children's. Another big event we have coming up is trick or treating. So we do trick or treating throughout the whole hospital. So we have different booths set up and different departments help. And the kids are all dressed up. It's really cute. And they all have costumes. We're able to hand out costumes, and they come and they trick or treat around the hospital. And then another one, this is more of a recent one that we started doing, and it's the Christmas tree farm. And we are so thankful again for just the support we have outside of here, but they provide Christmas trees, little fake Christmas trees, and we set up our whole little patio area and inside this room right here, which is called the performance area. And it is truly like a winter wonderland. We have fake snow, we have the tree set up, and the kids get to come pick out their tree. The Grinch makes an appearance. We have Santa Claus here. It's just a really neat opportunity to, again, hopefully give them the chance to be a normal kid as best as we can in this setting. But we do weekly events. These are just some of our kind of larger events, and we have many, many more. We have Superhero Month coming up, just all kinds of things. We started doing a Thanksgiving Day parade, and it is really cute. So we actually have different departments participate, and they decorate a float. And we go throughout the whole hospital, and it's a whole Thanksgiving Day parade. Really big deal. It's very cute. So we are thankful that we get to kind of put those events on alongside some of our other people within the hospital, like our foundations and corporate comm and a bunch of people like that. So we are very grateful to get to do some of the fun things. Our days can sometimes be very heavy. And so, having the balance of getting to do that as well is very, very exciting. So yeah, I think if y'all can't think of anything else, we kind of wanted to make sure we touched on all the different roles of a child life specialist and what all we're kind of doing here at Children's. And I think we were gonna check about questions now.
Yeah.
Yes. Oh my gosh. The work that you do is absolutely incredible. I have many questions for you, but we do have one on the chat, and it's from Lauren, and she asked if all pediatric hospitals have certified child life specialists.
I think most pediatric hospitals do have child life specialists. Some of the programs are smaller. I know we've had some specialists come to Birmingham that work in like one-person programs, but it does seem that most pediatric hospitals do. And then even like pediatric units in an adult hospital typically have child life specialists. And I do feel like it's more common now to see child life specialists in alternative settings. I know there are some that work in schools or dentist office or ENT clinic, yes, advocacy centers. So our skills are really transferable to so many different environments, and I feel like that becoming more common to see child life specialists in other areas as well.
Yeah, that's great. I mean, I honestly can't imagine a setting where a child life specialist would not be needed. But I was curious, like, it sounds like y'all have some amazing support at Children's, and I didn't realize y'all were up to in the 20s of, your team. I am curious, are there, and if so, what are some common like misperceptions about the field and what you do specifically as a child life specialist?
Feel like there are a lot, so I'll have you guys chime in as well. I think it surprises a lot of people how much how many requirements there are to be a certified child life specialist. I think people sometimes there's misconceptions that our job is super easy and that anyone can do it, and so I think really we do go through 4 years of, not just training, but just, we have these 10 core classes that are required for us in order to complete these next steps of completing a practicum and having volunteer hours with sick and well children, and then, completing an unpaid internship. And if that doesn't guarantee an internship isn't in your area. Like I personally I'm from Alabama, but I had to move all the way to Boston to complete my 600-hour internship just so I could graduate and then sit for my certification exam. And so there's a lot of moving parts to it, and it's a very, very growing and competitive field. And so I think that's just one of the misconceptions that we have. I don't know if you guys have any on the topic.
I would say, because we, again, like we do get to play with kids, but when we do that, it is not just playing with kids. It is our opportunity to get to assess and implement, interventions, but also like get to see kind of where the kid is at, because that is the way that children are able to verbalize things, is through play. And so I think that sometimes people think, we laugh about it. We're like, we are not just the toy lady, I promise. Like, yes, we get to play with kids and it is great, but there's so much more to it than just that. And so I think that, there's definitely some misconceptions with that as well.
I agree, but I feel like I echo what they said. My favorite comment is like, that's such a fun volunteer position. It's like, yes, I'm carrying balloons around for let's say a birthday, or like I am doing these things, but also we're jumping to the next room and having really hard conversations with patients and families. So people do get to see a lot of the fun piece of our job, but there's a lot more to it than that. And I feel like that's a big misconception across the board.
Yes, absolutely. Well, I also have a question for you. And again, just to our audience, if you have any questions for our guests, please put them in the chat. But I feel pretty sure I can fill up the time and ask you more than you want to be asked. But one of my questions also, so I know like being, interdisciplinary is absolutely like a key part of what you do. And so I would assume that you interact with, physicians and nurses and, all members of the healthcare team. My question would be, my next question, having engaged with all of those different, professions, is there, and what would, if there was a new nurse, a new, physician, a new therapist, whatnot, coming into the hospital, and they said, hey, what's one thing that will really help me, with my patient outcomes, or, help me, just engaging with patients and families, what would that be?
To call us. I do a lot of education with I work in the emergency department, so we have a high turnover rate with nurses and nurse practitioners, and we have residents and new attendings that come on board. And so I know all about the hospital. We do education, but I feel like when I'm meeting these new, residents and meeting these new nurses in such a quick environment, I try to emphasize that, we are a free resource. We are trained professionals to help work alongside each other to essentially help, the patient, but also to help make their job easier. So we talked about how we try incentive plans and how to increase compliance, and that minimizes the amount of resources the hospital needs, minimizes the amount of time the patient needs to be at the hospital. And so, theoretically can save, the hospital time and money when especially in the emergency department, when we have a flood of kids that are coming in. And so I feel like, we are just such a helpful resource that a lot of people don't know about child life until they're in the hospital environment. So we really just emphasize education on our role and how we can be of help, and just how to utilize us appropriately and how to work as a team.
And I think because we have to be very present, like we're here, 5 days a week. I feel like just like I would do with my patients and families, I have to get to know our staff and they have to get to know me. And it starts with that. And I've learned that is like a huge part of mutual respect for each other and our roles, because it's really not about my role is more important than theirs, or theirs is more important than mine. And so I feel like, and it's easier on a unit that's such a chronic population, and I've been there for so long, you know, that comes with time, but it makes it a little bit easier for them to be like, oh wait, I need to call Lindsey for that. Or, you know, we're in rounds in the morning I'll speak for myself, with our team. So like with the doctors, and we are rounding on the patients every day. And so I think just being a presence, like just being there constantly helps with that. And we do like new hire orientation. So we're a part of all that, getting our new nurses and stuff, like to even understand what child life is. We're a part of all those educational kind of moments as well, for sure.
Okay, great. Now another question that I have, let me pause and read some of the comments that we've gotten. So Savannah says, she wrote child life specialist equals MVPs. And then Camilla said, thank you for the positive impact you make on the patients and families. And then Holly asks, how do you manage the many hats you have to wear? And is there room for certified child life specialists to have like different specialties?
I think just a big piece of kind of navigating all the different roles we have in the hospital is just trying to be as flexible and adaptable as possible. I might think I have like a plan for the day when I come in, and then we got a new patient or someone's having a procedure over here, like different things pop up that you don't necessarily plan for. And I think just being flexible and being able to move from one situation to the next and kind of just start fresh. I feel like it can be easy to leave a really hard patient situation and not be able to, it's hard to leave it there sometimes and not bring it into your next room. And so I think just trying to approach each situation with like a fresh lens and trying to kind of just focus on that particular need at the time. And that helps.
We also are very thankful to have the team that we have, because if we can't pick up one of the other hats, like we are able to reach out if there is like, you know, a crazy need. I was just thinking about how on my unit, there's 3 of us child life specialists, and we just had a really hard week last week. Many deaths, unfortunately, and it was just awful, if I'm honest. And so I also had to go celebrate a birthday that same day. And it's like you're going from one emotionally exhausting to the extreme moment to trying to get it together to go celebrate a birthday. And it's like, we have to take care of each other too. And I think that's where it's really neat, is like nobody outside of the walls really of this building or our role, even if I'm thinking of that, can understand like what the day-to-day is like, except these people. And so if it's that I need to go get a birthday something together and I just literally can't get my life together that very moment and I just need a second, I can reach out and they're going to be willing to help. And that goes on to say as well about our boss. She is just incredible at making sure that we're taking care of ourselves in order to be able to take care of these patients and families every day. And so there are many days that it's been a hard day and she's like, you just need to leave. There's nothing else you can do in order, and to do it well, like we have to also take care of ourselves. So very thankful for that, to have the team members we have and a boss that just cares for our emotional and mental health as well. So yeah, it's a struggle managing all the hats, but we try to utilize all the resources we can for that.
What was the second piece of that question? I'm trying to read it from afar and
it says, is there room for certified child life specialists to have different specialties?
I feel like one of the great part of our jobs is that we are able to learn so much on one unit and be the child life specialist for that unit, but we also are able to move to different units as well, and then kind of learn that I guess, specialty of that unit. So, moving, like Kassidy and Lindsey had said, they both have worked in the emergency department, and their, I guess their focus was on that emergency plan of care and, responding to those traumas and in those hard patient situations kind of back to back. But then they were able to, move to a different unit where they're working on with the team on kind of that specialty, if that makes sense. So, for cardiac and then for BNP as well, it's we're very, what's the word I'm thinking of? We're specialized in, I guess, in those areas.
Populations we serve.
Mm-hmm.
Yeah, and it sounds like there's a lot of like cross training that you have to do to be able to serve different patient populations. So I have a question about adults. As you were describing all of the incredible and critical components of your work, I think about adults and adult patients. And I mean, to your knowledge and obviously I understand that, part of child life is understanding the different developmental, phases that a child goes through. And that's, important part of the work. But, some of the things that you talk about, I imagine that could be really beneficial for adults as well. And so I'm just curious, in the field of child life, are there any, child life specialists, but that do similar work for adult patients? Or is there like a movement to have that? Or
It's funny because I'll have parents all the time that'll be like, oh my gosh, we need an adult life specialist. And while we don't personally obviously work in the adult hospital setting, there's standard protocol, I know for myself with bone marrow transplant, that education and stuff is all done with our parents just as it is with the kids. And I say it even to our teenage patients that are oh, a child life specialist, what? I always am look, if I was in the hospital, I would need to understand it broken down like this in a very concrete way. So hey, I'm 31 and I would need to hear it this way. So let me just show you what it's like. I'm going to do it with your parents as well. But we've definitely found that, these doctors and stuff come in and they speak, their certain language, and it can be overwhelming to them. And then we're able to backtrack and process it with them. And they are even oh, wait, I didn't understand that. Can you kind of go over that a little bit more? And we can do it in a more childlike way. But saying all that, I think adult facilities would love to have child life specialists there. And I think that there's a huge need for it, because I would love to have somebody do what my role is for kids, but for me as an adult.
I do know there are some child life specialists too that work with patients or children of adult patients. So I don't think there are any in our area, but I know sometimes they'll work with children of oncology patients, or on a hospice type unit. Child life specialists will go in and work with the children of those families too. So that I feel like it's becoming more common as well. But
it's actually common for those pediatric units that are connected or intertwined with an adult setting too, because we, just speaking on my experience when I worked in Boston, that we were constantly consulted to the adult part of the hospital to help with an adult that was not doing so well, but bringing in their children in and helping teach their children to familiarize the medical environment and what certain things and monitors are for and what they're doing and how they're helping, and kind of just being, kind of connecting, just like Lindsey was saying, almost kind of like that elephant in the room, where they both, think children know something's going on that maybe shouldn't be going on, and then also the adults wanting to help but not sure how to start that conversation. So just bouncing off what Kassidy was saying, that I think that is becoming at least more known for the hospital, the adult setting.
Well, I so appreciate your time. We're about out of time. And so again, what you all do is absolutely critical. I know that. And it's an honor for us too, as UAB Arts and Medicine, to be able to work with you guys. And of course, Jennifer Conway, she is amazing, and it's an honor to work with her. I'll just read. Melinda says, thank you for all you do for children and families. Another person says, thank you, so appreciated. So again, your work is so important, and we need more certified child life specialists in the world. But yes, and someone else said Jennifer Conway is absolutely amazing, and her staff. So you guys have a lot of fans, and I know the families and patients that you work with are just so grateful for the work that you do. And then it's clear that it's an honor for you as well to get to do this work. And I know it must be very difficult, but also impactful too. So thank you. Just for our guests or our participants today, thank you so much for being here. Our next virtual Mental Health Monday will be September 18th, and we are going to talk about traumatic grief and holistic approaches to healing with UAB's Dr. Rebecca Ramp and Dr. Brian Kirklin, who has a therapeutic farm actually in, I believe it's in Tennessee. So please join us for that. Again, Lindsey, Kassidy, and Kaitlyn, thank you so much for your time. And everyone have a great day.
Thank you.